MiraLAX is an over-the-counter medication primarily used to treat occasional constipation. It belongs to a class of medications known as osmotic laxatives. It helps to soften stools and increase the frequency of bowel movements. It is also used before certain bowel procedures, such as a colonoscopy, to clean out the intestines. MiraLAX is also sold under other brand names, ClearLax and GaviLAX. Common side effects of MiraLAX may include nausea, abdominal cramping, bloating, and gas. Less common but more serious side effects can include severe or persistent diarrhea, severe or persistent abdominal pain, rectal bleeding, and allergic reactions such as rash, itching, swelling, severe dizziness, and trouble breathing. For adults and children 17 years and older, the usual dose is 17 grams of powder, or about 1 heaping tablespoon dissolved in 4 to 8 ounces of water, juice, soda, coffee, or tea once a day. For children under 17 years, use only if prescribed by a healthcare provider. MiraLAX contains polyethylene glycol as its active ingredient. Polyethylene glycol works by retaining water in the stool, resulting in softer stools and more frequent bowel movements. It is minimally absorbed into the bloodstream, making it effective locally within the gastrointestinal tract. Do not use MiraLAX if you are allergic to polyethylene glycol. Consult with a healthcare provider before using MiraLAX if you have kidney disease. Prolonged use or excessive doses may lead to an electrolyte imbalance. Monitoring may be required for prolonged use. Do not use if you have a bowel obstruction, ulcerative colitis, Crohn's disease, or toxic megacolon without consulting a healthcare provider. If you find this video helpful, don't forget to like, share, and subscribe for more informative health content. Stay tuned for our next video.